Hello, good morning, and welcome again to another amazing episode of your favorite program, Focus Salone. Focus Salone, they come to Una every day at exactly 8 a.m. to 9 p.m. and to 9 a.m. On AMAZE television channel 32 only. And inside this program, we now a flagship program, we talk about different things in the country. We talk about politics, we talk about entertainment, we talk about health, and a lot more. As usual, we they bring the program to Una. Me now, Una host Lydia K. Talker and
Karim Osise and Fumble into Wednesday, and it's yet another fascinating content episode on our user program. We now focus Salone, and in today's edition, Fumble we get a very interesting topic of discussion. We are in its interest all and sundry, that is everybody in the country. We are in the topic now, effect of mpox in the country. But Fambolem, una back when we watch, listening to we, una able give una input, suggestion, comment on the topic we can discuss because we value the views, the respective thought of the followers and reviewers. And therefore, you send your comments and thoughts to the number +232 79 72 22 89. But Fambolem, we want to go in for a short commercial break. When we come, we can kickstart the business proper. Therefore, fasten up your seatbelt. We shall be right back.
Coffee Korea's Freetown. 100% Robusta coffee, proudly made in Sierra Leone. We offer hot coffee, coffee bags, green coffee, cocoa powder size, 100 gram. Our coffee beans are grown and harvested in Kono and Kenema in the east of Sierra Leone, roasted and packaged in Freetown by our friendly team. About us, we provide ready, available, and affordable coffee bag to the market. We do free coffee tasting and delivery service. We do coffee consulting service. We do coffee guide and training. We do coffee tour. Our facilities: breakfast, meetings, training, and Wi-Fi. For wholesale, you can contact us on the number +232 88 26 3333 or visit the nearest supermarket at 47 Wonsab Drive, Spur Road.
Online. Are you having difficulty with your internet service? Worry no more. Online has got you covered. At Online, we make it easier for you to engage with members of your communities through our new social media network called Limey. Once you've signed in, you can browse for other members in your town or city. On our Limey social network, we've got an array of top musical and artistic talents from Sierra Leone, including Emerson, Famous, Young Sal, Innocent, Rosie, and many others. Heard about Shop Online? Here's the catch. Shop Online is an exciting platform to search for goods and services throughout Sierra Leone. At Shop Online, you can buy and sell
Trust me, we're not going to be able to talk about mpox because this person profile is very heavy. But I will precisely introduce this great somebody. Well, this great somebody is a community health worker, a community mobilizer, and of course a team lead for both that of the house to house and that of the Western area urban vehicle sensitization. And in all his top play, this person gets a wealth of experience on national issues because during the course of COVID-19 and that of Ebola, he happened for being at the forefront. But Fambolem, I know for Bona with regards to this person in personality and that of in profile. Therefore, this gets somebody who they can help you for a month into this discussion topic when the effect of mpox on the country, not to know less an individual, but Mr. Collins Thomas. Good morning, Collins Thomas, and welcome to today's edition of Focus Salone.
Good morning, and good morning, viewers.
We're so happy for getting you at the studio, sir. As of course, we
It's
know
a pleasure.
these are very important things right now with the going at the country, and forget
Yes, of course.
opportunity for talk about that. I think it's very much good that we still they strive for build up the awareness. So as we talk about the effect of mpox in the country, I just want for make you give us a brief background. Being the lead member of the Western Urban Mobile Vehicle Sensitization sensation team on mpox, just give me a brief background about this team here first.
Well, mpox is a viral disease where the country may not declare in February because at that time they will record the first case. So, but it all reach to certain level where you activate another level of response because you get national NPHA, which are the National Protection Health Authority. Yes, the National Public Health Authority, when then they take care of anything with the of epidemic scale. Because nothing will for affect all man, I think with the collapse country, so when it reach to certain level, they activate certain response way for raise awareness, preventive measures, done treatment, linked to treatment, and forget trust in the health system. So basically, nothing they will do within this past 3 weeks.
All right, so now that bring up the team so that we're able for Syria for tackle this problem.
Exactly.
So how far the team don't they do, because we don't record so many cases there for the past month, and every day the cases they increase. So how the team don't they handle that right now?
Well, we are bound for increase because of one reason. The mpox, the people then they keep them. Some people they treat them as chicken pox. You the men and house, and a very dangerous virus. Once you get them, it transmits easily by person to person. So what do we do? The response put measures in place where one, let the people know about mpox. Let them know the effect we forget on you, the country, and the economy. Because you are either infected or affected. So nobody will say mpox business, not to me business. Now we all business. So the response, the MPH, develop the response where everybody come on board. When you get the community people for go back to the community, because I trusted face. Somebody will trust for tell you about this thing, then you will respect them. So first of all, you tell person what is mpox, how we turn like, who are they at risk. So all the one and then they will do the mobilization done. They want me to keep an house. Now then they come out now we make we say cases and they rise. And one of the two when we make cases they rise, we don't get that much treatment center. But now they don't put measures in place. Even to on Monday, a new treatment center was commissioned at Calabar Town. So now they don't get sufficient treatment center now. So whosoever suspected of this thing, would they link them to healthcare. Then the healthcare now they call the treatment center, they can take them, where they go take care of them, then treat them free. But now not just say we get mpox or any rash we get, not chicken pox. That is wrong. When you get rash, go to the hospital, then they go diagnose you who's kind of rash. Because the mpox rash is sudden rash and fever, followed by fever. Down your throat, where they call lymph nodes. Then you get grind. Normally, we know say now we get sore, you do get grind. But this one now, you get grind. But in some people, it may come as a disguise. Like, they treat them like STI. Because we get in our private part depending on the sense of hygiene. So now we may miss. We make them home in the treat them as STI, and majority spread. But we not know. But when the professional one thing we are like this country for brain, we have it. The only thing we lack is the finance. But when you get to such a level, then they activate the response, where the response is presently doing very well.
All right, thank you so much. So we want to know how mpox actually affects the healthcare system in Sierra Leone. because yesterday we get Dr. Kamal. We can talk about mpox and the effects of mpox, and he explains a lot of things there. He explains the mpox don't they for some time now, but now people don't really get their awareness because we don't begin to record death cases, and it don't spread out to over 2,000 or 3,000 cases that we don't get. So how it really don't affect the healthcare system as Salone?
Well, first of all, the healthcare system in Sahel is very fragile. Fragile in the sense they respond. Malaria, the target. Child mortality, everything, now an issue. So if they not tackle them as early as possible, people then go lack trust in the system. Typical Sahelian, no one go hospital.
Yeah.
Typical Sahelian, you get malaria with the treatment house, we know they go check.
We believe
nothing.
backyard pharmacy so much.
Thank you.
But you are in malaria, just go take drip, no more flush out.
Thank you.
Flush out.
So then are the great problem where if we not handle this thing properly, it go affect you all. Look, we mode of transport. How would they take vehicle? Almost power get car. Would they overload? So the only thing we promote is preventive measure, which is one, get the awareness. What is mpox? How it transmits? Don't two, how you go prevent yourself. When at this one word we don't start from Ebola time, Corona, which is hand hygiene, hand washing. When you come out tongue, avoid crowded place where possible. If it's not possible, when you come out tongue, wash your hand with clean water and soap. Then you touch whosoever you want to touch, like your husband, your pikin, because these are vulnerable groups. Pikin, when the vaccine comes out, they never get anybody with under 12. But then they say they catch the virus. So now preventive measures, now the thing will spread, because all this awareness, sensitization, you call it whatever adjective you are use. Now just that, the preventive aspect, because prevention is better than cure. And it's cheaper will prevent than you get you get for house the person. You get for feed them. You know, the people that we get for care for them one and day, you get for pull them from one sector. Now say they are within the main health system where they service other people, where a little bit strained by itself. Then you get for go pull people and they for can take care of the special people here. You see, so it affects a whole lot. So now we could promote the sensitization, the prevention, and the protection that will link to healthcare.
Amazing, Collins Thomas. Of course, like it's been a very interesting discussion on your part. Of course, like you already mentioned, like how vulnerable the beginning with regards to this mpox, and of course, is to discuss on the effects of mpox in the country. Like you know, say like we go center out on three bases: the social, the economic, and out of the psychological aspect. But to start with, I want to know like the set of population also vulnerable. Is it the youth, like the adolescent, or that of like the ageable people? And secondly, and most importantly, like what are the effects of COVID-19 so far on the social fabrics of the country?
Well, the vulnerable space. You get people that we get underlying cause, we get weak immune system. You know, we don't live with some diseases then, like TB, HIV. When then people they become infected, then they have high risk. Pregnant woman, high risk, because the woman, the picking they take from the woman. So the immune system every day, you ever go hospital. You know, say pregnant woman now, first time they say go hospital 3 times before you born.
Yes.
But now if you go hospital 8, 9 times before you born, every month now if you go hospital. Because they're going to check your response and the fetus. So if they want they go become infected, how dangerous it be? And we try to reduce maternal death. Yes. So all the things they are vulnerable. They get children.
You don't get any case of any pregnant woman with mpox so far?
I think yes, we don't get one pregnant woman. Then the first case them way from Lumley, where the man don't get awareness about the thing, so they get for abscond. But later on, we find out the man may die.
Wow.
Yes, but the woman, I think, they may track out to one traditional healer. because it's in a witch cocoa, so they abandon the area, go Waterloo. But the link with the response get with traditional healers, they may able to pull them out. Now the traditional healer, I say, go hospital. Now I even call the hospital. Then the response was prompt, but by then the man me at large, he just the do it like. So then people then are vulnerable like a Pekin. Me and you would know how to take the necessary precaution. But almost you could tell Pekin we go able to do where they under 15. You know, we're not able to contain ourselves that much.
Yeah, so
they are very vulnerable.
Yeah, so call is like if picking a vulnerable, look at the attachment feel you are in picking a mama, like they always sync together or they are parents. So like if the picking like they are infected. So how safe the parents are in this regard?
Well, step one, we find out not to the picking they go bring the virus. Now the parents they bring the virus. How? Picking when we go to some schools, they already tell them the preventive measure. Then can one believe when they go now and they say teachers say, then they take down the very serious.
Yeah.
But we were big, we like to take things for granted.
Exactly.
Now with the common tongue, when you go to house, they say they get one word where they picking and teach me say before.
Yes.
When big one come on school, the young one they
for embrace, like exactly.
They can embrace.
Exactly.
But if you teach that picking, they say when you go to house before you young one, do hand washing with soap and water.
They do them.
It do am. Well, but you are big now. Either you urgent, I don't late for cook, I don't late for this. You go just put your bag and start the work. Don't begin get for car mama. So now we get for protect. How you to protect them? Just do the IPC measure, which is infection prevention and control. Let us not take everything for a rush. When you come out, when you know say you for do hand washing, sanitization, do it. Then we protect. Not only we picking. This thing a virus, it can there. It is alive. I can take out with my hand. I go with them. But it need for enter the body. Either I pick my nose, I rub my eyes, or I bet my fingernail. You know we hygiene.
Yes.
I can shake your hand. I don't give you. But it not enter you yet. But when I go on the other side, I do the hand washing. Then I don't dispose of the virus.
Yeah, Collins, like you don't believe back picking can serve as a vector or like as a vehicle for like contract the disease and for can get their parents, because like the measures you've just highlighted or discussed, where in for instance for washing and sanitizer, some people right now are very reluctant. They might have been cautioned, say we're gonna this side, do this exercise, or like you know, so picking back they forget that forgetfulness brain. You can tell us something we go in the exhaust that measure they. So like I don't know if like if there is no tendency for like picking them contract disease they can't get them parent. This mpox.
Well, according to waiting Mr. Collins, they say there is a tendency, but in just they say like the parents them more they at higher tendency for transfer.
Because we understand I'm saying like it's not the parents they contract disease.
Mostly.
Well, it's
say always, mostly.
What?
You see, picking we don't interface with them. Trust me. We don't interface with them. Especially the one they under 12. When you get to the school, when you tell them something,
they'll do it.
They will do it. Even when they play with them company, not touch me, mpox they now. You know, it playing at the brain.
Like that. Mind you, Mr. Collins, our community engagement man.
I
when they talk to them, picking
I know. That's the presumption, you understand it?
So he's talking out of experience.
Yeah, I know, but like not all thing fix.
Yeah,
there might be a
presumption,
presumption, but
right.
it's understood. Thanks for the awareness.
To be frank,
yes, sir.
Listen, let me say mpox is here. As long as we all take the necessary precaution, we go protect and not for taking it outside.
Yeah.
So let me say it is within the picking them. When they play, then they sweat. As long as they are protected, it is within that confined day. When they move from playground to class, the teacher they institute hand washing. Yeah. You wash before you go to class. When you kind of host that pattern, then picking them now, when they get complacent, they picking them the wastewater.
Oh yes.
Trust me, because when you tell them picking them, they see. So we always protect them, because when picking sick, you know what that mean? It become restless, it become expensive, it affecting school. You the parent, you get to go work, you get to go drag, then you get to go cater for picking. So it affects the whole fabric of a society. So whether we like it or not, if we not put measures in place for stop them outside a door reach. it will affect the economy big time. Transport. We sit 5. Then go say for reduce the transport. Then go say for reduce everything. Now picking in the sit worse. If this mpox come, then bring lockdown. You know, you see the effect.
Yeah.
Because you get that rippling effect. So they all go say, but let me mpox and just whatever. We can say no. Either you are infected or you are affected. But now with all business.
Yeah.
So we need to take them very seriously. And the word is mpox na sudden rash we they call it fever. Pega pack, not the main mpox. Chalk, where we can rub white, you know the main mpox.
Yeah.
Now only when you go hospital, then they will tell you whose kind cocoa you get or whose kind rash you get. Done. If na chicken pox, then go tell you waiting for take. If na mpox, then go link you to treatment center with the treatment na free.
Obvious.
But the point is, let we promote hand washing hygiene. Where possible, we avoid crowded place. Where possible,
Yeah, no.
because it's very difficult.
Yeah,
It's
sure.
hard. It's hard.
Challenging.
Every day you go work, you go for go market.
Through transport.
Anyway, we go hear what. So we want for know, like, what's not the support or resources where the government don't they provide for like response to this mpox?
Well, presently, the resources where the NPHA they use, now from government where the minister may present, the case na parliament, so the government make so emergency fund where they give, when they then take activate this response, because the response day for about a month. Within that month day, we definitely go get high case, like I used to say, high cases, because in case have been done there, but they within the community where they keep them.
Yeah.
We will not get treatment center. So you come, we treat you, you go na house. But going na house, you really do all the preventive measure where they say isolate yourself in a house, not touch. You did do them. So we still a spread. So now when the treatment center don't come now, all of that when they treat in a house, we take them to treatment center. Then the primary contact, like now, you get or me get the mpox. We are all contacts. So as long as one person has been tested positive, then the vaccine, the balance, whether you don't show signs and symptoms, because we work on the preventive now, because the vaccine not sufficient for give everybody in Sierra Leone.
Okay, colleagues, like since the vaccine not too sufficient for the all at the country, someone go live say okay, like if I get any signs or symptoms of mpox, I prefer go contact that of a herbal specialist. So like are there any measures like or policies being put in place on the grounds like if herbal somebody take responsibility for treat a patient wherein is being suspicious of having the signs and symptoms of mpox? Because it's very key, it's very challenging. Because like if there are no measures or policies put in place for somebody they go contrary to those policies, I believe see the trend of like spreading that of the mpox, I believe it will be very challenging aspect.
Well, just like I say, Sierra Leone, a country where we're blessed with brains, ideas, and people, human resource. The only thing we can lack are the finance. When this thing started, they bring in the traditional leaders together. Then tell them the negative effects of this thing. So they say they're aware. You remember Ebola? They were very adamant.
Yeah.
Now only when they change the dynamics, bring them on board. Now that they themselves know say this thing is serious.
Yeah.
The same thing applies in COVID. You know, COVID, the effect of COVID we not praise ourselves. We not always praise ourselves. But because of that Ebola experience, we'll bring into COVID, we'll tackle them. People less than 200 people die in a Salone of COVID. We other countries then die boko. Because of them measures in there. You don't bring in the traditional healers, you don't bring in the community people. Like now you belong to a community. If you're a community mobilizer on health, every time when they see you, they know saying something positive. Because you are respected in the community, you are trusted in the community, you are the face of the community. So you're not going to bring anything bad or bad information to that community there. So that is where trust comes. That is where trust comes in. So when they take you for do this thing, you for belong to that particular community, you forget trust in the health system. Because I trust, they make when I sick, I go hospital.
Yeah.
If I know say when I sick, I go hospital, better know the day. That means I trust not the day, I will not go there. Then the word traditional healer comes in. But when you trust the system, or when still some people bypass the system and go to this traditional healer, now the traditional healer now they call.
Go and back.
So that has been the
And we don't get proof.
Exactly, that has been the chain.
Yes. Because they are involved in this response.
Yeah.
Okay.
So it's very good that now they get involved, because if not, we will continue to get problem. One problem they produce another one. So that's very, very smart. I go recommend and
The boss up there.
Yes, the boss up there.
Yes, now then they
that's a
design
very
that.
smart move. So we still there in the discussion, but we want to take a short break. When we come back, we go take some few text messages and continue with the discussion. How Mpox story really affects Sierra Leone. We'll be right back.
Introducing the AMAZE TV app. Entertainment everywhere, anytime. Key features include unlimited live streaming, live TV, high quality streams, and on-demand content. It has a user-friendly interface, personalized recommendation, can be accessed anywhere, and more. Download the AMAZE TV app from Google Play Store or App Store. Why wait? Download the AMAZE TV app today for more content. You can also visit us at our website www.amazetvsl.live. Also catch up with us on all our social media platforms. Coffee Korea's Freetown. 100% Robusta coffee, proudly made in Sierra Leone. We offer hot coffee, coffee bags, green coffee, cocoa powder size, 100 gram. Our coffee beans are grown and harvested in Kono and Kenema in the east of Sierra Leone, roasted and packaged in Freetown by our friendly team. About us, we provide ready, available, and affordable coffee bag to the market. We do free coffee tasting and delivery service. We do coffee consulting service. We do coffee guide and training. We do coffee tour. Our facilities: breakfast, meetings, training, and Wi-Fi. For wholesale, you can contact us on the number +232 8826 3333 or visit the nearest supermarket at 47 Wonsab Drive, Spur Road.
Hello and welcome back to your favorite program, Salone, where you come to now all in AMAZE TV, channel 32. You self can be part of the program by sending in your text messages to the number +232 722289. And we still there on the topic where we did talk about how Mpox affects Sierra Leone, the effects of Mpox in Sierra Leone. We get few text messages to the oncoming side of the program. I go read and we guest callings go respond. So we get we first message we come out from Mary Bangura where they all the way Hastings. It say, what has been the geographical spread of Mpox in Sierra Leone? Are certain regions more affected than others? That's the first question. Then we get another question from Momo Masai, where they now bottom mango. He say, how are local organizations, international partners, and government agencies collaborating to combat mpox? Then we get another one we come up from James Sano, where they now Spolu. He say, has mpox affected trade, travel, or any other economic activities in Sierra Leone? Well, these are some of the questions and the thoughts of people where we don't get so far. So, Collins, you can kindly respond to some of them questions they are. The people curious for no.
Well, the geographical balance is really bad for wedding of Freetown.
Okay.
You cannot know why.
So Freetown more affected than any other place?
Yes. Now how we go school, now how we civilize, now how we get, we polish, we everything. But now how boko, because now how we tranga is. We feel so we know.
And you're right.
This assume what they assume, now they are factory. Because this not all data I get so. But about 1 month old, when the case me did 2,559, Western area urban alone me get 1,659. We rural, we na the Waterloo, me get 533. You get other region them, the highest was 132, which was Bombali. Then at the north, you get some side we na 4, some na 24, but Freetown, because now we congested.
Yeah.
We housing is not too good. Don't somebody they ask about the international organization they support.
There.
Well, for now, we get that Trump syndrome.
Okay.
Where most of the international people don't withdraw it. So
They don't ban.
then they help in their own way.
Okay.
Like the vaccine, let them procure them.
Okay.
Yes, because this Sunday another 20,000 come. The initial those women come was a little over 61,000 for a population of 8 million. 61,000 dose.
Yeah. Small.
Yes. So we go get another set of people that will give you another 20,000. So then get the own limit. But for activate them basic thing, you need PA system for go out. You need flyers, then IEC materials, information, education and communication material. You get for design them in a way that who don't go school.
They go understand.
When you see the picture, if you like you know able read,
They go understand.
you go understand.
Yeah.
So man, not they listen radio or not they listen television. Now waiting WhatsApp say. So you get for follow them on that platform there. So you bring in una way young, we active in that field there. And you know go just take you from your life without any, they will not pay you. But stipend will be provided for some basic service when they take you out of your comfort zone and bring you. Most of them when they are being done by government.
All right.
To my knowledge.
Okay.
I stand to be corrected. Yes.
Okay.
They're waiting at the last one because it was 3.
Yeah.
How will it affect the economy?
Yes.
Will the prayer not affect the economy yet?
Okay.
Will the pray? Although yes, it don't affect them because the money now government will put into this thing should have been used elsewhere.
Yeah.
So whether you like it or not, na pull here, put here. Then at least demand and supply.
Yeah.
Opportunity cost. You picking one to have back door, you want cook. If you picking goes na street empty food, Papa go shame. But you need food. What's why important? So you get for balance, you get for check what you forgo for satisfy the other one. So now that will play. Now, government will pull here, put here. If they deploy for the sector, for can satisfy this one. So now we all now for join hands together, let it go as soon as possible. Then we're not going to see them physically, say they are factory, but it is. Whether we like it or not, it is affecting us. It is affecting the country. You will not see it physically.
Yeah.
But just like I say, now pull and put between demand and supply. Which you forgo for satisfy what? Not to say we'll get the money, we'll keep on the bank of Sierra Leone.
Yeah.
When you want it, you go take. No, now somewhere you go for staff, for go satisfy other side.
So I want for make we, as we round up, I want for me to talk about, you know, bringing more education to people out there, people we don't know, especially the one within a village. We're not going to understand the English them boku, but MPOX. So as a community health worker as well, what are some of the ways right now we don't put together for the campaigns, for make more awareness talk, for able for reach out to our communities, them we not get access maybe to internet or go now WhatsApp for see waiting they go on. What are some of the things them where they in place for able, educate people more on MPOX? Because the more the information they, the more people go able for take precautions.
Well, this now ongoing fight.
Okay.
Whether the response close or not, they include community health workers because then don't they na the community already. So part of their job usually put another, like say another module or another subject.
Okay.
You will do art, but now they say when art they add drama day.
So now directly they work with health centers, hospitals, community health workers them for able for
Exactly.
more information.
We own primary focus now for liaise with the community and the facility.
All right.
Hey, what happened with that picking? You know well, you can't go hospital.
Okay.
Get trust in the system. Hey, until you know say MPOX day now. Do you have anybody who see we get this thing? Let we can't go hospital. No, not tell us say get MPOX so. Let we say let go hospital, let them go check what in do for reduce the stigma because all that they get for bring and come into context.
Yeah.
Not stigmatize the person say you get MPOX.
Scared for going to hospital because of stigmatization. How well una can handle that? For you to protect people and secret them.
Well, this not a secret.
Well, it's not a secret, but some man they afraid for gonna make the cases they increase as well. So how una able to protect them for make them not be stigmatized by them community, other people then.
Fine. Now I don't go to you, I don't pass like backyard because we are all from the communities.
Sure.
I don't pass like backyard. We talk to you one to one, the neighbor not go for you. Okay. Don't go hospital. Before you reach the hospital, we don't call the clinician or IDSR officer.
Okay.
Integrated disease response officer. You got special people now we all hospital get. When you come, yes, anything, now Mr. Collins send me. Or now this person send me. So as you say now Mr. Collins send me, you know what's next.
Okay, amazing.
You know what's next. Because we get the people then you call the names. Now Mr. Collins send me. Yes. Straight away the gap usai they like it in the public. In the gap, it can go to the isolation and treat you get written and call case investigator. If they can investigate you see you get 2 or more signs.
Alright. Before you confirm.
Before then call the lab.
Alright.
Where they can do the test. But then originally it was you wait for the lab to come. But now, because 98% of who that we don't send na hospital become positive. There and then once you get there, case investigator they prepare your mind. Who that you left na us. One can you go to treatment center one time. Let us start the process. Because if we tell you go to us, let us say you are positive, you go to us back, you go spread that. You go touch. You go hey at the camel.
It must interact and socialize with other set of people and so it's a high tendency for late transfer.
Now make us say Sierra Leone, we really get the brain, we evaluate. After every week, they evaluate.
Okay, so
you make recommendation.
Okay, I mean, Collins, like due to the exigency of time, like people are often know, like because you're a national ego, because you don't involve into a lot of fights regarding virus system of this country, ranging from COVID-19, Ebola, and up to the MPOX. So like people go out forget that comparative analysis in terms of the challenges so far regarding the MPOX, the fight in MPOX, and that of Ebola and that of COVID-19.
What the only challenges we would get for now? I've seen our finances. Okay. Because COVID, it was international pandemic. This one now, in African context, so the limit and though we don't get this Trump syndrome. Because you don't go, this MPOX will talk so globally, it in 111 countries.
Yeah.
It in 111 countries. But because it don't affect them in that magnitude, they not take them. So it is high time we step up. How would they step up? We'll not say let them go bring money. Let us just do the basic things. You get a tree, you get some fruit and low hanging fruit. which is wash your hands. Hey, awareness is there. Don't do this. These are low-hanging fruits. You don't need ladder. Wait more for being ladder now for let you go up the teeth.
So it's all about cooperation. Like if government say don't do this, you just need to abide by the rules.
You can foresee reason why.
The precautionary measures them. I think with that, like we work hand in glove with government and ourselves, because for like prevention of vital disease, it's a collective.
It's a collective effort.
I just think they rounding up that will be final message. So what do you go tell the people of Sierra Leone?
Me people Mpox is real. Mpox day. If it spread past how it spread so, it can affect you all. You either gonna market, then go put restriction. You either run transport, then go put restriction. Picking the way to go school, you go get restriction. You know say water. Now every day we get water. If they go put you lockdown, you go get water. So it get for affect we all. So the only advice we get for one now is let we do the measures the way they say not for do. Let we not play with person we get the disease. If we play with them or if we touch them, let we wash we hand with soap and water. Let we not tell person say you get Mpox. See that crocodile way you get, you don't go check in a hospital. Let we advise people, let we not keep them in the house. Let we advise them for go hospital. Not to say go take pega. Where I'm get chicken pox. Now so this one is different. Not to chicken pox. Now only when you go hospital, the master sabi people then go tell you whose kind rash you get. Don't if na chicken pox then go tell you what for take. If na Mpox, the treatment na free way they go carry you go na treatment center. Then they open another treatment center way. You not go strain for anything. But please, me people them, me family them. Now we all get for come together for let this thing go as early as possible. Now we know they see the effect physically, or we know they feel them physically. But for the government to respond, you get for pull money here, put over here. Money not there for do all kind of things. But now only when me and you join on and do the right thing, which is when person get caught, we send and go hospital. When you mix in a public place, when you can house, don't wash your hand with soap and water, clean water for that matter. Where possible, let we wash.
All right.
On that note, I tell you thank you.
Thank you so much, Collins O. Thomas, for being part of the program today. Thank you for your advice and the message we don't send out to the people there. I hope say Sierra Leoneans we go listen and we go take precautions so that we go able to get a safe Sierra Leone for we all. Thing fine now for we all. Thing go bad back. Even if you not get the sickness, you could be affected. So thank you so much for being part of the program today. As we end the program, we want to take three wise word for today.
And family, guess what? It's an interesting quote for today's edition. And guess what? The person who sent this wonderful quotation. The family shop now. It comes from Magama Muyama Mansai. We are in Wolstena Uptown Road, Kuntolo. He said, you know, means say we born in Pekin. We name him Solomon. That means say forget sense. Well, family, this is our say goodbye to now. And don't forget, Coffee Korea.
Thank you so much. Plenty thank you to Coffee Couriers for being our consistent sponsor for this program. And one for say plenty thank you to Una consistently to watch the program. On behalf of we CEO James B.K. Ovoni, we say thank you. And I want to say thank you to production manager Abubakar Siddiq Kamara. I want to say thank you to the man at the control room, Abubakar Kamara, and I want to say thank you to the whole management of AMAZE TV for where this program that they make sure so they work together for make it come to now. Till again, I've been your host Lydia K. Talker. We will see you now tomorrow at exactly 8 a.m. Bye and thank you for watching.